Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
C-section. Introduction. A cesarean section, or C-section, is the surgical delivery of a baby through an incision in the abdomen. If your healthcare provider recommends a C-section, the decision to have this procedure is also yours. This program is about C-sections. It discusses why they are needed, how they are performed, the risks of the procedure, and what to expect after the procedure. Anatomy. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. The female reproductive organs include the ovaries, fallopian tubes, uterus, vagina. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. The lowest part of the uterus is called the cervix. It opens into the vagina, which opens to the outside of the body between the urethra and the rectum. During labor, the cervix slowly becomes 10 centimeters, 4 inches wide. This is called dilation. The cervix also becomes thinner. This is called effacement. The mother is only asked to push when the cervix is fully effaced and dilated. The path the baby travels through the cervix and out the vagina is called the birth canal. Reasons for a C-section. A healthcare provider performs a cesarean section if he or she thinks it is safer for the mother or her baby than vaginal birth. Most C-sections are done if unexpected problems happen during labor. The most common reasons for a C-section are 1. The baby is not tolerating labor. 2. The baby is not in the right position. 3. There is not enough room for the baby to go through the vagina. 4. The cervix does not dilate completely. 5. There are medical emergencies. For instance, problems with the placenta or umbilical cord may make emergency C-section necessary. Sometimes healthcare providers know ahead of time that a C-section is best. If the mother has a medical condition such as diabetes, heart disease, lung disease, or infectious diseases of the genital area, a healthcare provider may suggest a C-section.
Some women ask to have C-sections with their first babies, hoping to plan the delivery time and avoid complications of vaginal birth. However, this may complicate the deliveries of their future babies. If you are considering having a C-section for your first baby, discuss with your healthcare provider your options and risks. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Procedure. A C-section takes place in an operating room. It typically takes about a half an hour to an hour. If the mother is in the delivery room when a C-section is needed, she is moved to the operating room. The anesthesiologist gives the mother anesthesia. Regional anesthesia is usually used, but general anesthesia is sometimes needed. For general anesthesia, the mother is asleep and cannot see, feel, hear, or remember the surgery. Regional anesthesia can be given through an epidural or a spinal block. These medications are given through a needle or catheter in or around the spine. If you have regional anesthesia, you may still be able to feel the baby being pulled out, but will not feel pain. After anesthesia, a healthcare provider makes 2 incisions. The first incision is through the skin and abdominal wall. The second one is through the uterus. The incision through the abdominal wall is about 6 inches, 15 centimeters long. The incision goes through the skin, fat, and muscles. After making the abdominal incision, the uterus is opened. After the baby is removed from the uterus, the umbilical cord is cut. Then the placenta is removed from the uterus. The incisions are then closed. The stitches on the outside may be dissolving stitches or non-absorbable stitches or staples that may have to be taken out. Risks and complications. A C-section is a safe procedure, but like any surgery, it has risks and complications. Knowing about them may help you prevent or detect complications early if they happen. All surgeries carry the risk of infection or a reaction to anesthesia. Anesthesia is safe, but like any medicine, it can have risks. The risks and complications include those related to anesthesia and those related to any type of surgery. Regional anesthesia may be injected where it should not go, or it may not go deep enough to work correctly. Injury to a nerve can also happen. Risks of general anesthesia include cut lips and chipped teeth, headache, nausea or vomiting, problems urinating, sore throat. More serious risks of general anesthesia include heart attacks, lung infections, strokes. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Risks and complications related to any surgical procedure include infection, bleeding, scarring. Infections could happen on the skin or deep in the abdomen and pelvis. Antibiotics and surgery are sometimes needed to clear up infections. If there is a lot of bleeding, sometimes a blood transfusion is needed after a C-section. Scarring may happen. It is rare for the outer scar of a C-section to be unsightly, but internal and external scarring may be painful. There is a risk that organs near the uterus could be injured during a C-section. This might require another operation to fix the possible damage. After healing, a uterine incision could leave a weak spot in the uterine wall. This might cause problems if the woman tries to deliver another baby vaginally. Rarely, the bowel slows down for several days after surgery, resulting in distension, bloating, and discomfort. This is called ileus. Babies born through C-section may have lungs that are still wet. This can cause a mild respiratory difficulty and rapid breathing. Healthcare providers can give the baby extra oxygen. They may use oxygen under pressure to force fluid out of the baby's lungs. This rapid breathing typically goes away within a few hours or days. The baby may be less likely to be breastfed because of the difficulty of caring for the baby while recovering from surgery. After a C-section. The stay in a healthcare facility after a C-section is 3 to 4 days. It is a little longer than the 1 or 2 day stay for vaginal delivery. Recovering after a C-section takes longer too. After a C-section, you might need pain medicine for a few days. You will also feel weak or tired. It is important for you to walk. This helps prevent blood clots in the veins of the legs and pelvis. It also prevents fluid buildup in the lungs. It is normal to be depressed after a delivery, whether it was vaginal or cesarean. Those feelings usually go away. Even so, it is important to tell a healthcare provider about them. He or she may recommend a support group or prescribe medication.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A C-section is the surgical delivery of a baby through an incision in the abdomen. It is a common procedure. Most C-sections are done when unexpected problems happen during labor, such as the baby not tolerating labor, the baby not being in the proper position. Other problems that may require a C-section include not enough room for the baby to go through the vagina, emergency problems with the placenta, the cervix not dilating completely. A C-section is a relatively safe procedure for the mother and baby, but like any surgery, it has risks and complications that include infection, bleeding, and scarring. After healing, A uterine incision may leave a weak spot in the uterine wall. This could cause problems with future attempts at vaginal birth. The stay in a healthcare facility after a C-section is 3 to 4 days. It is a little longer than the 1 or 2 day stay for vaginal delivery. Recovering after a C-section takes longer too. After a C-section, you might need pain medicine for a few days. You will also feel weak or tired. It is important for you to walk. This helps prevent blood clots in the veins of the legs and pelvis. It also prevents fluid buildup in the lungs.
Thank you for using Explain.